Welcome, everyone. We'll give just a minute or two longer for people to get logged in and settled, and then we will get started. Good morning, everyone, and welcome to our Accords Education Program Seminar Series, Methods and Challenges in Conducting Health Equity Research. I'm Sarah Brewer. I'm the director of our education program at Accords, and I want to welcome you all to today's education program seminar. So first, what is Accords for those of you who are new to our series? Accords is supported by the University of Colorado School of Medicine and Children's Hospital, Colorado. It's a unique one-stop shop environment for faculty to conduct pragmatic research, receive various types of services and supports for grants and projects, and incredible mentorship, training, and education in health services research. We support faculty in conducting pragmatic, real-world research to improve healthcare and outcomes, providing a number of services. So a multidisciplinary collaborative research environment, strong methodological cores and programs, consultations and team building for grant proposals in particular, mentorship, training, and support for junior faculty, and extensive educational offerings like these, both locally and nationally. Before I move into a little more about today, I just want to let people know about some upcoming events. So on March 1st, in just a couple of weeks, as part of our Hot Topics in Mixed Methods and Qualitative Research, we have Marty Otoñez speaking on harm reduction story sharing with people who use drugs. In the middle of March, we have the next in this series, using mixed methods to understand nuance and disparities work, photo, voice, and Medicaid studies with Margarita Alegría. In April, we have, again, as part of our mixed methods and qualitative research series, Rupali Lemay talking on longitudinal qualitative data. And want everyone to know that coming up, we have our Colorado Pragmatic Research and Health Conference, June 5th and 6th on the Anschutz Medical Campus. And our theme this year is reassessing evidence, what's needed for real world research and practice. And registration is now open at coppercon.com to get signed up to join us in June. Now, before I introduce our speaker, just a couple of housekeeping items about our seminars. Please use our chat throughout the seminar to share your questions, comments, talk with other attendees if new ideas are coming up. We will have moderated Q&A at the end of the seminar, so please share your questions there and we'll make sure to address as many as we can at the end. And then second, watch for the evaluation as we come up on the end of our hour together today. That helps us be sure we're meeting people's needs around our educational offerings. Now, today's seminar is part of our Methods and Challenges in Conducting Health Services or Health Equity Research. It's the 5th of 8 in our series this year, and we welcome Dr. Spero Manson. Dr. Spero Manson is Little-shelled Chippewa and is Distinguished Professor of Public Health and Psychiatry. He directs the Centers for American Indian and Alaska Native Health and occupies the Colorado Trust Chair in American Indian Health within the Colorado School of Public Health at the University of Colorado Denver's Anschutz Medical Campus. His programs include 10 national centers, which pursue research, program development, training, and collaboration with 225 Native communities spanning rural, reservation, urban, and village settings across the country. A medical anthropologist by training, Dr. Manson has acquired $268 million in sponsored research to support this work and published over 300 articles on the assessment, epidemiology, treatment, and prevention of physical, alcohol, drug-related health issues, as well as mental health problems over the developmental lifespan of Native peoples. So please join me in welcoming Dr. Spero Manson.
Well, thank you very much, Sarah. In the words of my people, Ani Buju, welcome to a good day. It's my privilege to begin sharing with you some of the lessons learned in terms of my work and the work of my fellow colleagues over the last 4.5 decades about how to engage and undertake meaningful work in terms of research with tribal communities. And I've chosen the antecedent to my talk as nothing about us without us, which is, I think, one of the underpinning principles in regard to this particular topic among Native communities. Next slide, please, Jordan. So let me begin by noting most of you in the audience may be thinking of American and Alaska Native people in terms of racial and ethnic appellations. While that may be appropriate in some contexts, we actually don't think of ourselves in those terms. We are members of tribal sovereign nations, domestic dependent sovereignties that are established by treaty with the United States government beginning in the early 1860s through the 1890s, which affords us a very, very special relationship with respect to the federal government. And you will see it represented here in part. And understanding that is absolutely critical to your understanding of the issues and pathways and how to navigate those pathways in terms of engaging tribal communities and undertaking meaningful research with us, and not just simply concluding that research, but being there in the long haul in terms of helping to translate the implications of the findings of that work in meaningful terms. So let me begin by noting, as a consequence of matters of tribal sovereignty, we have seen begin with Presidents Reagan and Bush, a formal acknowledgement of the federal government's relationship with tribal nations in terms of a government-to-government interaction or obligation on the part of the federal government to tribal governments, in which we began to see explicit policy laid out how all of the federal agencies and departments and offshoots thereof should comport themselves in engaging American Indian Alaska Native communities in the context of not just research, but program design, any kind of sponsored work. Next slide, please. Let me drop back why this is so important and why this government-to-government relationship and the ensuing tribal consultation process has become ever more important and acknowledged as essential to establishing and pursuing these relationships. There have been 2 landmark studies that have underscored the consequences of undertaking work that does not proceed along these lines, that proceeds without reference or inclusion or participation of tribal communities in the nature of this work. I'm going to briefly reference 2 of these studies for you. The first was the Spero alcohol study undertaken in the late 1970s. Spero, Alaska is, I think, probably known to many of us as at the heart of the oil fields on the North Slope. It is, of course, the home to a number of villages, Alaska Native villages. And in this particular instance, a group of colleagues, well known to me at the Institute of Man with Tulane University, undertook a pseudo-epidemiologic study of alcohol abuse and dependence in Spero and the surrounding area. They were deeply concerned with trying to understand the nature and extent of alcoholism among the residents of these communities, Native as well as non-Native. The results of that work were subsequently reported, next slide please, in January of 1980 at a major conference in New York. Now, the headlines the day after the report screamed the following, that the all Alaska natives, Eskimos in the vernacular of the day, which is further inappropriate, are alcoholics. However, when you dug into the study design itself, was seriously flawed, so that in fact the results were almost predictable from the outset. This particular study reported that the alcoholism rate was over nearly 3/4 of all of the adult residents in the village of Spero met criteria for alcohol. And as I pointed out, the study was fatally flawed. Most of the work was done in the context of jails and lockups, where the vast majority of complaints that led to those individuals being incarcerated were in fact for chronic inebriation and public disorderly conduct as a result of drinking. There was not a community-based study of alcoholism. But the real point of this is in the New York Times and the Washington Post, the headline screamed that all Eskimos are alcoholic. As a consequence, not only did the local Native community in Spero, but throughout Alaska, become stigmatized, painted by this brush of alleged alcoholism, of drunkenness, further reinforcing the stereotypes that have been long held in regard to American Indian, Alaska Native people generally, again, quite flawed in their description, led to serious economic consequences. For example, the bond rating of Spero prior to the release of this study and its sensational treatment in the general media was an A rating in terms of bonds. 1 month after these headlines and the release of this report, it dropped to a C+, costing Spero, Alaska, tens of millions of dollars in its ability to finance local community development programs. And so it affected not only Native but non-Native people. And that study has reverberated throughout Alaska and the discourse that Alaska Native people have had regarding research ever since. Next slide, please. The second major, highly publicized incident has to do with the Havasupai tribe versus Arizona State University in the late 1990s and in the late 1980s and early 1990s. This particular study and the incident involved really began in the context of an investigator from Arizona State University establishing a relationship with the Havasupai tribe to try and understand factors contributing to the risk of or protection from diabetes among tribal members, which is legendarily prevalent among Native people particularly. Undertook a study that included not only the gathering of self-reported psychosocial risks and protective factors, but also collected biospecimens that were stored and at the point in time in which the study was approved by the tribe were intended to inform further the potential genetic markers of risks. Well, let me go on, and next slide, please, Jordan. While there has been a lot written about the genetic contributions to diabetes among American Indian, Alaska Native people, unfortunately, as is the case generally, that particular line of inquiry, as the similar line of inquiry with respect to alcohol dependence and among Native people, have not been particularly fruitful. They have been equivocal at best. The real point here is that subsequently those biospecimens became available or were made available, not by the tribe, but by that investigator in the university to other faculty and other investigators to inform and be used to pursue other unrelated research unrelated to the original intent of the initial study that had been approved by the tribe. And all of that had been done without prior consultation with the tribe. And so what we saw, in fact, was that much of this work, for example, sought to identify, using those biospecimens, genetic markers of of ancestry and migration over time, and other kinds of adverse conditions and genetic diseases of concern to the investigators, not to the tribes. And we saw then a whole series of articles emerge that focused on schizophrenia, questions about inbreeding, and, as I noted earlier, migration patterns, which relate to assertions about ancestry. Next slide, please. That particular line of inquiry actually led to a major lawsuit that was settled out of court between ASU and the Havasupai tribe. My point in sharing these two incidents with you is that these and others like them, unfortunately, these are not the only ones. There are many, many others that have not reached the national prominence that these two have historically over the last 40 years, but they reverberate throughout American Indian Alaska Native communities today and have driven much of the efforts to codify and to bring a greater structure and control over the research processes involving Native people, not just in federally recognized tribes, but now state recognized tribes, urban and off-reservation rural areas as well. So returning to the government-to-government consultation that Presidents Reagan and Bush Sr. had implemented much earlier, we saw that the Clinton administration acknowledged the importance of this process as a consequence of the sovereign status of tribal nations. And we saw then in 1994, an executive memorandum issued by President Clinton that reinforced and expanded the obligation of the federal government to tribal nations in terms of this consultation process, and that there would be nothing undertaken in those communities without prior advisement and inclusion. Next slide, please. What then we saw begin to emerge right at the same time and on the field by this further expansion of the consultation process was the emergence of a series of actions within tribal communities. They were largely in terms of the establishment of institutional review boards under the jurisdiction of tribes themselves. That initially began in coordination with the Indian Health Service. The Indian Health Service is the largest federally sponsored public health agency responsible for the health and welfare of federally recognized American Indian Alaska Native communities. So we saw then begin the emergence of institutional review boards that were supported initially by the Indian Health Services Charter, and that subsequently grew to be secure their own charters under the Office of Research Protections at the National Institutes of Health. The Navajo Nation Human Research Review Board and the Cherokee Nation of Oklahoma in initial institutional review boards were among the very first and the most prominent and precedent-setting, but they were soon followed by many others. The Oglala Sioux tribe in south central South Dakota, the Choctaw Nation, also in Oklahoma, as is the Cherokee Nation, and out on the West Coast, we saw the Northwest Portland Area Indian Health Board establish their own institutional review boards. What did these institutional review boards seek to do? They sought to ensure that those communities themselves had increasingly greater control over and secured increasing responsibility from the investigators who were approved to undertake the work with their tribal members in terms of establishing this kind of bilateral community partnership, and also ensuring being subject to the codes of human subjects research. And I'll come back to the translation of some of those codes in a few moments. It's important to note that at the same time, these institutional review boards, such as ours at COMER, the Colorado Multiple Institutional Review Board, began to broaden in their scope, not only in terms of the application and oversight of human subject protections measures themselves, but these institutional review boards also began to acquire greater jurisdiction over the review of the research itself, in a broader sense, thinking of the communities as the focus for the research as much as the individual members of those communities. So you see the Oglala Sioux Tribal Research Review Board, the Cherokee Nation of Oklahoma, the Choctaw, the Northwest Portland Area Indian Health Board, the Navajo Nation Review Boards. They are broader. They do render judgments about the alignment of the proposed research with the health priorities and concerns of their constituent communities. They take great interest and exercise oversight in terms of the designs of the study and how those may be consistent or not with the local landscape. They take great responsibility for ensuring the ongoing review and evaluation of the research, and ultimately great control over the production and dissemination of the products, scholarly or otherwise, that may come from that work. And they require that the investigators who are approved to do that work have an obligation that they follow through on in terms of re-engaging the community at strategic points to inform them of the outcomes of this work. Next slide, please. The federal obligation to the tribal consultation process we see further underscored in the George W. Bush administration in formal ways. And in fact, we see here our own Senator Ben Nighthorse Campbell, who was very prominently involved in many aspects of healthcare with respect to Native people, working hand in glove when representing those interests as in the congressional level with the executive office. Next slide, please. We saw too President Barack Obama's administration taking this process even further. And in fact, whereas President Clinton was one of the first presidents to actually go and visit tribal communities, in his case in the Southwest, in several pueblos in the Navajo Nation, President Obama went to Standing Rock Sioux Reservation in South Dakota and spent several days there working with those tribal leaders to better understand and reaffirm the federal government's commitment to these codes and way of doing business with tribal nations. There was a hiatus subsequently with respect to the Trump administration, but this process has been revitalized, reaffirmed under the Biden administration. Next slide, please. What we saw as a consequence of this emerging affirmation of the federal responsibility to work hand in glove through tribal consultation with federally recognized tribes, a series of policy and as well as pragmatic procedures begin to emerge. We saw within the National Institutes of Health, located in the Office of the Director, the Tribal Health Research Office being formed. And led by a Native scientist with a Tribal Advisory Council to the director of the National Institutes of Health, in which major health policies, both research and otherwise, that are considered and enacted within the National Institutes of Health are regularly reviewed by this Tribal Advisory Council. We saw too that with major toolkits emerge within DHHS more broadly in terms of how investigators and administrators should engage tribal communities in this process to ensure that they were both aware of and acting consistent with these policies and procedures. Next slide, please. Well, what I'd like to take you into now is shifting a bit from the codes and the rules and policies themselves that provide the overall governance for these kinds of relationships from pre through post-war and subsequent efforts, to what are some of the organizational, political, and cultural differences that I have seen over the last 4.5 decades emerge as tribes, investigators, state and federal governments have sought to identify common ground for the narratives that inevitably surround the discussions about research and how to proceed with research in a meaningful and locally beneficial way. So let me talk briefly first about the organizational differences that we frequently see, and I'm going to emphasize here largely the differences between universities and federal government and those of tribal communities. So if we begin first thinking about organizational differences from the point of view of universities and federal government, what do we see? We see that the decision-making is essentially hierarchical and rule-driven. We see that the process itself emphasizes efficiency, replicability, and written documentation. Any of us who are scientists and investigators working within our respective institutions know this well. The nature of the thought processes are analytic prominently. It assumes for the most part that there is an answer to be discovered in addressing the issue on the table. And ultimately, what's valued is instrumental competence. That's what's highly valued, and it's the standard of assessment. How well the investigator in the institution, university or federal or otherwise, aligns its actions and pursues those actions with respect to a given set of policies and procedures, typically of its own making. Now, set that in sharp contrast to tribal communities. In tribal communities, the decision-making process, rather than vertical and hierarchical, is very horizontal. It's precedent-oriented, and it's essentially consensual. So you see committees, tribal councils, other advisory bodies that are charged with the authority of the tribe itself, with engaging with the outside world, whether it be an investigator, university, or a government, another government, about this decision-making process. In tribal communities, this process is very fluid. It is highly iterative. It is recorded for the most part orally, and it's benchmarked by key events, not by time chronologically for the most part, but by key events. For example, oh, when you were last here, Dr. Manson, we decided upon X, Y, and Z. It wasn't in March of 2015. We think very much in terms of benchmark events that characterize the flow of discussion and decision-making. Leadership in tribal communities is shared, it's diffused, and it's ascribed rather than attributed. So that, for example, although an individual may chair a tribal council's health committee, or the individual may be a council member, or even the president of a tribal council, that is not necessarily the singular focus for decision-making and where that power resides. It is actually just simply a point of reference that is responsible within the local landscape for ensuring that decision-making is undertaken in more traditional, in terms of tribal processes, ways. We see that there is an emphasis on distributing cognition, thinking about these things, that there isn't an assumption that there is a single answer to a particular question or issue, but there may be and often are multiple answers. So what we see then is that this decision-making process is very deliberate, seeking to identify all of the possible answers to a particular question, and examining that question in the first place to ensure that it is the right question to be asked, and then ensuring that there is adequate airing and consideration of all of those answers. And then lastly, in tribal communities, authority is invested collectively in the competence of the community and the bodies that are charged with representing that. Next slide, please. Let me turn to differences of a political nature between universities and the federal government and tribal communities. So, with respect to universities and the federal government, representation by an individual occupying a particular position. I'm going to apologize in advance. I have remodeling going on here in my home in Oahu, and I'm going to have to battle a little bit some of the background noise. So if it gets too much, please let me know. I'm sure that you can hear that as I am. So
I haven't heard anything yet, so you're good.
All right, great. So with respect to universities and federal government, representation is of a collective of individuals, of constituents. It's largely lodged within an office or a position, and the individual who occupies that. The objective is to govern or to control the individuals or groups thereof. Competence is perceived as stemming from delegated authority. as maybe sort of earmarked by administrative license. Accountability is couched in terms of blameworthiness and liability. We know that all of us in our respective institutions who are faculty and scientists, we constantly think in terms of risk reduction, of making sure that we don't violate the rules. Obedience is through instruction and compliance. Those are, in my experience and my perspective, and many others, the basic elements of politics within universities and federal and governance, such as state and federal governments. In sharp contrast, in tribal communities, representation is of an individual collective, of a body politic. I'll give you a great example in a moment as soon as I finish here. The objective is to manage the interdependence of the relationships among the members of the particular community, in this case, the tribal nation. Authority is rooted not in codes or administrative license, but in moral, social responsibility of the individuals who participate in this decision-making process and its discussion. Accountability is not framed in terms of compliance with rules and regulations necessarily, but is framed as an obligation to and an acceptance by others who are the constituent members of the community. And conformity to those procedures, policies, rules, and manner of governance is presumed and reinforced in terms of adherence to shared values, not codes or regulations. Next slide, please. Lastly, with respect to cultural differences, in non-tribal worlds, culturally tend to be extremely person-centric. You can see that in terms of who is described as the leader of an investigative effort. You can see that in terms of how we talk about the nature of our study designs as subjects, as patients, rather than as full participants. We prize within this particular context privacy and anonymity. And that is, in fact, the watchword of most of our research around human subject protections. We emphasize majority opinion, and that 51% rules for the most part, without reference for the most part to the other 49%. Work here in this and the cultural orientation is very goal-directed, and it values solving problems, largely without reference to the process undertaken to accomplish that. And in many of our institutions, time is perceived as a commodity. We are deeply concerned about the amount of time that transpires from A to B, for the most part, because it has to do with our ability to move forward in the work consistent with the policies and procedures that dictate that work and the benchmarks that follows. And time is then something to be managed. And we become frustrated if we are unable to manage that time in accordance with the expectations and assumptions that characterize our view of the world as scientists, members of university, or various forms of government. And again, in sharp contrast, in tribal communities, we are very sociocentric. We are concerned less with the person and more with the community and with the collective body politic. We seek cooperation and we de-emphasize conflict. Now, doing that takes substantially greater time and more complicated process than is typically the case for those of us when we adopt our perspective as members of universities or governments. In tribal communities, we stress mutuality, the importance, and in fact, the ascendant value of belonging, of solidarity among us. We tolerate an enormous amount in terms of differences of opinion, value those differences of opinion, and air those differences of opinion through this consensual decision-making process. Again, it has major implications for how time and process are perceived and enacted in tribal communities that often come into conflict with those that we may hold as scientists or faculty or investigators. In tribal communities, we encourage a common vision, shared principles about how we will undertake our relationship, the definition of our primary efforts and ultimately the outcomes that we are seeking. We in tribal communities, for the most part, tend to be cautious, deliberate, patient, and we assume that events will unfold and they cannot be rushed. So those are some of the major organizational, political, and cultural differences between universities, state, federal governments, and tribal communities. Next slide, please. There are some major points of tensions that subsequently begin to emerge as a consequence of these differences. They have to do within the context of human subject protections, respect for persons, understanding of what constitutes beneficence, and also justice. I'll give you an example. It was about 30 years ago when I had the privilege of leading a major study of adolescent risk of and protection from alcohol abuse and dependence and other drug use among 5 different tribal communities across the country. One of them was in the Southwest and in several pueblos. And it had to do with developing informed consent. Now, no surprise to this audience, for the most part, we assume that informed consent is typically always individually person-centric and driven. And in fact, if we look at our institutional review boards, we see at COMER, for example, the language is entirely individualistically driven. Well, when I went before the tribal councils at these particular Southwest communities, I was told in no uncertain terms that the tribal council holds responsibility for the health and welfare of its tribal members. That in fact, although we may secure assent from the youth and their parents, it is in fact the tribal council that reserves the right to provide that consent on the part of the tribal members, youth as well as families who are part of their communities. I spent a year navigating those differences between our IRB at the university and the pueblos involved in the study and the National Institutes of Health. We were able to do so successfully, but it required first understanding the kinds of differences I have highlighted for you here, as well as developing ways to accommodate both. Next slide, please. Here are some very practical points of tension as a consequence of these differences. And first is the review and approval of research. As a function of the codification of these values, structure, and processes in tribal communities. And it isn't just in federally recognized tribal communities today. We see this among the urban Indian serving programs that we work with across the country as well. They may not have the same federal status and may not have the same dictum with respect to the mandatory requirement for tribal consultation, but they insist on it, and the federal and state governments recognize the relevance and importance of doing so for process. So all of these tribal entities and tribally derived entities require prior review and approval of research. They want to ensure that the nature of our work as scientists is aligned with their health priorities, with what they believe is important to undertake. They are no longer willing to accept and support research simply for the collective good of all humankind. They want to know very specifically how the proposed research aligns with their interests and priorities and what value it would bring to their daily lives. Tribal communities are very, very much concerned about the distribution of resources. You've seen that there are institutional review boards in those communities. They insist on those IRBs having an equal hand in reviewing the nature of the proposed research, not just in terms of human and community protection, but also in terms of its local relevance. But how, since they are not the recipients, typically, institutions such as universities are, of the indirect costs or the facilities and administrative dollars that support such things as IRBs, how are those IRBs at the tribal level resourced and supported? The answer was not straightforward. And in fact, 15 years ago, I, together with our tribal partners, went forward to the National Institutes of Health and made the case, ultimately successfully, that we should be able to include in our grant applications and subsequent awards budget line items that would provide for the local review and ongoing approval of both the research as well as its products when working with tribes that have such jurisdictional authorities. I've already talked about the issue around the matter of informed consent. What constitutes informed consent? Can the individual give away her or his right to the use of biospecimens or personal health information to external investigators for future work without the oversight and review and approval of tribal councils? The answer is becoming clear: no. The nature and extent of accountability and control. This goes back to the heart of the two major incidents back in the late 1970s and early 80s, as well as the 1990s, that I began my talk with. Where resides accountability? In what form does accountability take? Who has control over such matters? A very, very widely discussed topic now today is data ownership and data sharing. Who owns the data that is collected through the process of research? Who is responsible for the oversight, the stewardship, the curation of that data, for access to those data, for the providing those data to others who will generate products and oversight over the products generated from that work? And what are the requirements for continued collaboration? For example, if you're working with Navajo, they have 52 different what are called chapter houses that are like areas on the reservation. The requirement is that the approved investigators will work with each of those chapter houses that are involved in the research to, on an ongoing basis, report the progress and the results. So you can imagine the time and the resources that have largely been unanticipated by investigators and universities that now and must be built into the grants for which we apply and subsequently awarded. Next slide, please. There are lots of examples of successful way forwards, and I just highlight for you here 3 examples of data sharing agreements we and our colleagues have developed over the years with tribal entities that have worked very well, that make explicit the nature of these relationships, that attend to and address all of the points of potential tension that I've briefly identified and that I returned to in the middle portion of my remarks, that spring from these organizational, political, and cultural differences. So there are solutions to these kinds of things. But what it requires is that we as investigators and representatives of our respective universities anticipate the need to do this, that we develop those kinds of consultation resources with our tribal partners and can proceed accordingly. Next slide, please. So further emerging solutions is that we, for example, mentioned earlier that the Tribal Health Research Office at the National Institutes of Health has emerged. It's a major source of help to investigators who may not have that sort of background and understanding. It provides an enormous amount of resources, and I've depicted for you here some of the tools that they make available that I would encourage members of the audience to explore. Next slide, please. The National Congress of American Indians, the largest major advocate for urban, rural, federally and state recognized tribes in the country, is a wonderful resource. It has established a toolkit that provides trainings and webinars and videos and access to tribal leadership that helps the individual investigator or other institutions like our respective universities explore how these expectations and regulatory and compliance issues may be relevant to our particular work. And indeed, I would refer you, most recently, I had the privilege of co-chairing the Tribal Collaboration Work Group to the All of Us research program at the National Institutes of Health. And we developed a document for considering meaningful collaboration with tribal populations that I would encourage you to access at that website of All of Us research program, and provides very important instruction about how to undertake these processes. Next slide, please. Now, in closing, lest you believe that these are at the level of abstraction, the January 23rd, 2023 newly issued NIH data management and sharing policy has very specific provisions for a collaboration with American Indian Alaska Native people. There are exemptions that American Indian Alaska Native people have with respect to these data management and sharing policies that they are positioned to readily exercise, do frequently, and will so aggressively. So it's really important for those of us working with or considering the prospect of partnering with tribal communities to familiarize ourselves with these requirements and the latitude afforded American and Alaska Native communities. And I've provided below some links to various portions of the newly issued policies that will provide you with greater insight. Last slide, please. So I've provided you with a series of references to publications we've generated over the years that provide you with greater insight into some of these matters, and suggested blueprints for how to approach tribal communities, whether they be urban, rural, or reservation-based, that provide numerous examples that this can be done fruitfully, effectively, and that it can improve the science of our work. I want to underscore this latter point. Many of my colleagues initially, and unfortunately some yet, bemoan the fact that they are required now to understand and are subject to these kinds of requirements. I will tell you that the science that I have been engaged in has benefited enormously in terms of understanding from the very beginning the importance and how to frame a research question, the particular context by which to pursue answers to that research question, the particular circumstances locally for framing sampling strategies, for the measures and methods that we use to obtain the data to address those research questions. And once we have that data, for helping us to interpret the nature of the data that we've been able to secure. And then ultimately, they are part and parcel of the review of the products that are generated by this research that have, without exception, improved the quality, the meaningfulness, and the application of these products. I will tell you that there have been 2 or 3 major initiatives in the course of my 45 years in the field in which I have benefited enormously from that kind of guidance. Just 2 of them very briefly: the Special Diabetes Program for Indians, the coordinating center for which I directed for 16 years, which we served as the coordinating center for in Colorado, that had a $1.8 billion investment by Congress up to date. And the results were resounding, that led to the institutionalization of the innovative evidence-based practices that were culturally tailored and culturally informed, that have led to astounding reductions in incident diabetes among the participants. And another example, working with the Veterans Health Administration in looking at and being able to evaluate empirically in the most stringent fashion from Western science perspective, the value and contribution of traditional ceremonial practices to the reduction of risk and the enhancement of protection from traumatic events among our combat veterans who are American Indian Alaska Native, and leading to the reimbursement to those tribal communities based upon the evidence, a reimbursement schedule that in fact is still effective today, that is honored by the VA in compensating those nations for the provision of traditional healing resources to their veterans who have been subject to the vagaries of war and suffered from PTSD as a requirement. What that involves is not just the meaningful engagement of research as I've described here, but it also requires that we have a commitment to continue beyond the conduct of the research itself. I regularly testify before Congress, perhaps 2 to 3 times a year pre-pandemic, about the nature of these findings in concert with our tribal partners to be able to translate the relevance of the science to the implications of addressing those problems. And it's critical because, as many of us probably know, in the last 15 to 20 years, whereas previously wondrous stories and a personal witnessing and testimony were able to carry the day in terms of bringing congressional attention to a variety of health concerns and to securing the funds to justify new and continued funding. They are now a necessary but not sufficient condition to doing that. What is required is the marrying of rigorous science, of meritorious work that we can turn to as being embedded in the hallmark of the best that we are capable of as scientists within the context of the lived experience of the individual and the communities with whom we work as Native and non-Native people. So I'll close there and I'll gladly entertain questions.
Thank you so much, Dr. Manson. This is a wonderful talk touching on numerous aspects of how we need to proceed in working specifically with tribal communities, but we have a couple questions coming up about what can we learn from what you've shared to work with other communities that experience disparities, especially you grounded yours in this sort of government to government in relationships, and what does that look like, or what advice might you have for people working with other communities to translate some of what you've learned over your career?
Thank you. Well, I did work in the early years of my career among Southeast Asian refugees, but because of the focus on American Alaska Natives, I had sadly to set that aside as I narrowed my focus. But I will tell you, based on that work, as well as work in consulting, I'm here in Hawaii because I work with Native Hawaiian and other Pacific Island communities through the John A. Burns School of Medicine's Department of Native Hawaiian Health, that the dynamics are similar. That those points of tension that I described, that those organizational, political, and cultural differences that I enumerated previously obtained there as well. They are just not codified in the same fashion that they are in American Indian and Alaska Native communities. What it implies is that, one, you have to be very careful in the assumptions we make about who represents the community. I'm really amazed in the context of community-based participatory research, how quickly investigators will seek out and join 2 or 3, maybe 5 representatives of a given community, and will assume that as a consequence of that, they have now secured an informed view of what the community wishes. My advice to others is look carefully for the various groups, formal and otherwise, that are alive and at work in these communities. They can be formal or informal, but they are there, whether they're formally or naturally occurring. Reach out, ensure that you have introduced yourself to a wide spectrum of different perspectives and representatives of the community with whom you work. And the introduction alone is just the first step. It's necessary, but it's not sufficient. We have an obligation, and in order to continue to reap the potential rewards of an ongoing, lasting partnership that it offers in the manner that I've described, all the way from the design, implementation, conclusion, as well as application of the research, that it is an ongoing process, and that one has to commit oneself and one's team, one's institution, to a series of iterative, recurring conversations with those representatives. So it is a demanding process. It takes time. It consumes energy. But I submit to you that it is not only the right thing to do in terms of local meaning and benefit, it improves the science. I find it extremely rewarding. Some of the greatest friendships and lasting relationships that I've developed over the years are through these kinds of partnerships that have been established in the manner that I've described. And it gives a whole new meaning and a sense of reward to the work that I do. And I think you can probably sense from the enthusiasm in my voice tone that 45 years later, I'm still having fun and believing that I'm able to make some contribution, small as it may be, to not only the science, but to the benefit of this kind of work.
We have a number of questions about the pathway to do this work. So can you speak a little to what are the sort of entry points, and then what are those key things to do to maintain meaningful relationships, especially with tribal communities who might justifiably have distrust of researchers coming into their communities to work with them?
Of course. So the first thing is to do an informed environmental scan. Well, you want to work with a particular population or community. Try to understand it as best you can, and understand that the particular perspective you may take at the outset is just that, a perspective, that there are likely to be multiple perspectives. So spend the time understanding the structure and processes within the community. Communities have formal and informal gatherings. Go to those gatherings. Spend time with people. Introduce yourself. Listen respectfully and quietly. One of the biggest challenges I have is introducing many of my colleagues, not particularly those from the East Coast, with feeling the need to fill the silence that often accompanies social interaction in Native communities, that they have this need to prove their authority and to establish their credentials. Credentials and proof of worth are take different forms, not just in tribal communities, but in other communities. So my first recommendation is that you expose yourself, that you suspend judgment about what you observe, that you ensure that you have multiple points of observation in that process, and that sorry, I froze for a minute visually. I don't know if I did audio-wise, but that you ensure the diversity of introduction to the community itself. And then, yes, there's nothing worse. We've talked about it. This is an old hackneyed phrase, helicopter research, coming in, setting expectations, and then leaving at the conclusion of what you perceive to be the end of the research. The end of the research, frankly, is never. Once a community has committed itself to you, we have an obligation to commit ourselves to that community. And the last thing I'll say in this regard, expectation setting is critical. Do not over set the expectations. Be realistic. Work through together with your key informants, your advocates, your internal champions in the community about what's a reasonable set of expectations, what might follow from those expectations, but be clear about what those expectations and what you have raised in the way of the community's assumptions about how you will relate to them, not only just in the short and intermediate terms, but in the long run.
All right, one last question before we wrap up on the hour. What changes have you seen with NIH funding, especially for building in the time to do this kind of work well, to have the time to build those relationships with the community, to maintain them, to report back and continue partnerships? And how might people really be able to utilize those structures moving forward?
20 years ago, Sarah, there was none of this entertained by NIH. And in the last 15 years, I think a number of us have been more increasingly aggressive at a variety of different points in terms of the advisory groups that we are a part of to NIH, as well as in terms of our applications, making the case for why these elements are essential, not just to the conduct of the work, but to the articulation of the research question, to its translation into the local community, and ultimately the understanding of the implications of the results themselves. Now, you can't be glib about this. I spent 16 years on study sections at NIH in the early phase of my career, and I review still and consult on a lot of research grant applications. Applicants are far too brief and far too assuming that things are self-evident. You have to make your case. For example, in the nature of our epidemiologic work, we know that the costs of epidemiologic interviews in a community-based fashion are 2 to 3 times greater in the rural isolated communities that I work with. You can't take that as a given. You have to provide empirical evidence, and we do. And you have to take that approach on every element of the research that you're proposing, the IRBs and the resources for the tribal IRBs. You have to make the case for that. These cases can be made. I've tried to provide the audience today with some examples how that has been done successfully, and I encourage each of you, to the extent that you move in this direction, to do so, but in an informed and a fashion that can be adjudicated.
Excellent. Thank you so much for sharing your expertise and experience with all of us today. For those of you in attendance, please fill out your evaluation, and Dr. Manson, we will be sure to share the chat with you. There are a number of expressions of gratitude for your time today. So thank you, everyone, and have a great afternoon or morning for you out in the Pacific.
Great. Now I'm going to go see my contractors who tried to interrupt me 3 or 4 times over the last hour. So bye-bye.
Thank you.